Hi, we have probably heard of how doctors have saved lives and how nurses have made a big difference in their care for patients. But do you know there is a group of technical professionals who are working hard behind the scene in the hospital? They are the ones who design and develop life-saving equipment or technical gadgets that can be used in the care for patients. They are also the ones who ensure that all medical equipment in the hospital are in their tip-top condition and are safe to be used on the patient. Welcome to the Biomedical Engineering course, BME in short. Our course teaches on the design and development of medical devices or healthcare equipment. Some examples can include blood pressure machine and X-ray machine. The overall aim of our course is to provide a broad-based and practice-oriented training that equips our students with the essential knowledge and skill to work in the healthcare or medical technology industry. Broad-based as it includes training in several engineering areas such as electrical, electronic, mechanical, and programming. Unique to our course, we also train our students in life sciences. Then, what is practice-oriented? Our course is not just about knowing what it is, but more importantly, you have the capability to do it. That's why our course focuses on having enough hands-on session to equip you with the necessary skill set. Wonder what kind of job awaits you when you graduate from our course? Well, whether you are a detail person or a people person, there will always be some exciting job related to our course just for you. This can span across jobs that is related to design and development, equipment servicing, regulatory, and even to do sales. Now, how about if I want to further my study? What can I study after completing this course? Our graduates are widely accepted into courses in both local and overseas university. You can visit our website for the full listing. I've mentioned that the training in our course is broad-based and practice-oriented. So may I invite you to join us for free mini lesson online to have a glimpse of what this is. The focus of the free mini lesson is on a medical equipment we call Infusion pump. Enjoy the lesson.
When a patient needs medication or nutrients to be administered on a regular basis, we have two options. Option 1. A nurse would have to come, measure out the volume or dose, and inject it personally. Issues over time can be, firstly, boredom due to repetitive work. Secondly, consistency of dosage delivered. Thirdly, it occupies nurses' time from attending to more critical tasks. Option 2. Use an infusion pump where a nurse can program the pump to deliver the medication or nutrients at a specific time, quantity, and rate. This ensures that the patient gets what they need, while the nurse can also focus on other more crucial tasks. Therefore, the infusion pump can be used to administer medications or nutrients in a controlled manner to patients that is preset by a user such as nurses. Infusion pumps have some advantages over manual administration of medication or nutrients, including the ability to deliver in small volumes more accurately, precise program flow rates, or at predetermined intervals. This is especially useful in the treatment of very young patients, such as those infants in the neonatal intensive care unit. With infusion pumps, the risk of either under-infusing or over-infusing a patient is minimized. This also allows doctors to create a standard drug library that can be administered to patients for similar medical intervention. Like all other medical equipment, to understand an infusion pump requires skills and knowledge in both the fields of biology and technology or engineering. As mentioned, these can be categorized as the following. First, the human body. Second, technology used in medical equipment. And third, design and testing of medical equipment. As medical equipment are used on a human body, it is important for us to know about the structure of the human body. For example, anatomy. And as we put anything on the body or in the body, we need to recognize that there will be bodily reactions, for example, physiology. As a technical professional, A BME person will see anatomy as a system and physiology as a process. In this lesson, we will learn about the human body parts. This is extracted from our physiological system 60 PS module. Now that you have learned about some body parts, which is only one aspect of what is being covered in our BME course, let's look at the other aspect of our course in the next lesson, which is on the general technology used in medical equipment. For a BME person, understanding what makes an equipment work is just as important as knowing how our human body functions. An equipment can be seen as a system made up of many components, and understanding how these components work together as a process will help us in having a better equipment. In this lesson, we will learn about some of these components and their features. This is extracted from our medical electronics 60 MEDE module. To construct an oscillation circuit with a 555 timer IC on a breadboard, equipment used are power supply and oscilloscope. What we have covered in this lesson is called Electronics Workshop, Skills and Knowledge, which is important for us to have so that we can design, build, and implement meaningful circuits or systems for the healthcare industry. In the third lesson, we will look how we implement the design of medical equipment and how to test if the medical equipment is functioning properly. This is extracted from our Clinical Engineering 60 CE and G module. To build and implement an embedded system to mimic an infusion pump. To test the flow rate accuracy and occlusion test of an infusion pump. We trust that the 3 short lessons you saw give you some ideas on what you will learn and how you will learn when you join us.
We hope that you have caught a glimpse of what is in our course. Feel free to talk to us if you would like to find out more. If you like a technical career and you want to make an impact in the lives of patients or even to the greater community, do consider joining us. Stay safe, stay healthy, and hope to see you soon.